Okay, good evening, everyone. This is Ryan Hoyme, aka Massage Nerd, and tonight we have a special guest. Her name is Jeni Spring. She is a graduate of the Seattle Massage School and has been using her feet just as much as her hands to massage for close to 9 years. She has utilized Ashiatsu techniques with amazing success in clinical settings with a wide range of medical professionals over the years, educated her own local community building Ashiatsu awareness at a large public events, and has left a trail of completely revamped Ashiatsu enhanced service menus and spas spanning from Washington to Texas. In her own private practice in San Antonio, Jeni retired her hands and solely specializes in barefoot bodywork. For the last year and a half, she has been an instructor under Ruthie Hardy for Ashiatsu Oriental Bar Therapy, and has taught workshops and presented Ashiatsu at events across Texas, Arizona, Colorado, Oregon, and this fall she took Ashiatsu overseas to Germany for its first workshop ever taught in Europe. Welcome tonight, Jeni.
Hi.
So, what is actually Ashiatsu Oriental Bar Therapy? I know, I've seen it before, but some of these viewers have not. So, what actually is it?
Okay, well, first say ah.
Did I butcher the name? Sorry. Ashiatsu.
Ashiatsu. It's all right. It's all right. So anyway, Ashiatsu, it's Ashi means foot and Atsu means pressure, so that kind of tells you a lot right there. It's a barefoot massage technique that uses compression effleurage, strokes from our feet that glide all over your body, which you've probably seen. We can use our full or partial body weight as needed and create a structural change in chronic soft tissue damage. We hold on to our bars overhead, and they're there for leverage and support and balance. Our full name, Ashiatsu Oriental Bar Therapy, it's a mouthful, so sometimes we call it Ashi or AOBT or just Ashiatsu, but its name in itself is kind of our brand. It's our trademark. It's what sets us apart and lets you know that we are who we are, and so that's what we are. Ashi was developed by Ruthie Hardy. She's our amazing founder. She lives in Denver. She's watching. Everybody say hi, Ruthie.
Yeah.
So she came up with this, and it was accepted in '95 as the first nationally approved barefoot massage technique that uses overhead bars. So there you
go. Okay. And where did you learn from Ruthie then?
No, I learned from one of her top instructors, Jeanette, up in Seattle. She taught everything on portable bars at a bed and breakfast on an island in Seattle. It was a little escape, and it was awesome. And Jeanette's not teaching for us anymore, but she was for a long time. She's a really cool instructor.
So were you kind of hooked in right away after that first instruction then?
Yeah, I think I found out about it. I was still in massage school, and I had to do, you have to do that report on a modality, and you research it and everything. And I came across Ashi, and at the time I was a dancer, and it looked like the person was dancing during the massage, and I got hooked just by reading about it. So there happened to be a class happening in my neck of the woods like 3 weeks later, so I signed up for it. And it was the same day as my graduation ceremony was supposed to be. So I kind of skipped that and went to class. But it was awesome. It totally changed everything. And I don't think I've ever regretted it. I mean, it's the best thing that I've ever done with massage. So.
And you were first based in Seattle, right? Or up in the Washington area, right? Did you instruct up there much? Or did you mostly in Texas then?
In Texas. The whole reason why I moved down here was to instruct, because we didn't have an instructor here. So my husband's job moved us here, but I gave the okay as soon as I found out I could be an instructor.
So there's no complaints about the warm weather there then?
Oh, I love that.
And it's not rain 11 months out of the year?
Well, when it rains here, it means it. It just downpours instead of a kind of a drizzle that lasts forever. So.
Okay. And then you guys also teach a form. It's called Ashiatsu or let me pronounce it right. Ashiatsu, Ashitai. Okay, right?
Ashitai.
Yeah.
Yeah. That's our newest class. It's a really cool adaptation of traditional Thai techniques put to use with our bars. So it's a combination of compression and passive stretching techniques performed all by our feet. The overhead bars just allow us to stand up straight and avoid the common strain that some therapists experience when doing regular Thai and they're trying to lift and jostle and maneuver clients into pretzels, and sometimes you can get hurt. So Ashitai uses the natural leg strength to move the clients into poses while our upper body's kind of just hanging out, stretching itself open, relaxed. It's really versatile type of massage. You can incorporate into a lot of different things. You don't really have to bend at the waist anymore to lift. You don't have to use your arm or back strength. It's all in your powerful legs and the leverage that we have from standing up and using the bars from a standing position. So it's really easy to like swing a leg up and stretch so as, or flip the feet up over the head and do the whole what's called plow stretch to get the whole posterior aspect of the body. So it's so much fun. There's a lot of really cool foot transitions in there too. So I like it.
Are people usually clothed then with the Thai portion?
Yeah. With Ashitai, that's our only closed one. Everything else that we do is skin-to-skin contact. So there's a lot of draping with regular Ashiatsu.
Okay. And do you drape with the feet then? Do you use your feet to drape them then to exposed areas then? Or do you actually use your hands every now and then?
No, you have to make sure it's like secure and tight.
Okay.
There's some little tricks you can do to fix it with your toe, but you don't want your toes going where they shouldn't go. So yeah, we use our hands for that kind of thing.
And the coolest thing I saw was how you guys apply a cream to your feet. Then it just looks so fluid. I mean, it doesn't even look like you're.
There's another thing we do in class sometimes where we can apply the lotion at the very beginning, or the oil, I mean, with a paintbrush, so it doesn't even get on our hands. So when we go to grab the bars, they're dry and not slippery. So that's a little frou-frou trick that we have, and the people love it when they feel that warm oil being painted on their back. It's so luxurious.
Yeah, you can't get better than that.
Yeah.
And how long has the Thai version been around for you guys?
It's only like a year and a half. Kina, and she's the instructor in Denver with Ruthie. Her and Ruthie developed it, but I'm sure they were working on it a long time, at least 2 years, I'm sure. I've lost track. But we just launched it last summer. So there's only been probably maybe 24 classes in the last 2 years offering it. So it's still new. It's still awesome.
And is there a limit for how many people you can have per class then?
Yeah, only 8 people in any of our classes. So we have a small ratio. When there's 8 people in the class, there's really 4 people laying down and 4 people up on the bars working. So it gives a good 4-on-1 instructor-student ratio. So that you threw me for a loop. This was later in our interview.
Sorry.
Yes, there's only 8 people in our classes.
Yeah, but that's actually a nice thing to have only 8. I mean, some workshops I've seen people even 50 or even 100 even. So it's kind of hard to
It's nice. I mean, you get to feel every stroke from the instructor. The instructor can see every move that you make and make sure you got the right application and right body mechanics. You're working safely. You get a chance to feel every single stroke from the instructor. So we're very, very detailed, and it's just great. It's a great quality to have in a class, to leave knowing the work and understanding everything about it, because you have such a one-on-one ability.
And the bars, I mean, are those beneficial?
Oh, you cut out. What'd you say?
The bars?
Uh-huh.
Are those beneficial then? You have to have those in order to perform it or not?
Yeah, you do.
Okay.
So they're there for a couple of reasons. One is for balance, of course, so that we can comfortably and safely stand on a massage table without wobbling. They're there for support, so we can maintain the same consistent pressure from beginning to the end of the stroke. If we didn't have the bars, they might go to mush somewhere in the middle. And another reason is if the bars are built correctly, they're built to match the person's body type, the therapist, so that they're built for your body mechanics, so you can't get hurt. And it kind of coincides with the height of your table, so they're built specifically to the therapist. So you need them. You don't need those portables. Those are, I mean, we teach you how to build the permanent bars in your office, so you have something real sturdy and nice. The portables are a backup or something if you do events often.
And back in the day, the first massage I ever had was this guy. He was holding on to a beam, just one beam, and it didn't seem like anything like you guys performed. It was more. What would you consider that? Is that just more barefoot massage techniques or more shiatsu based or?
Yeah, there's a whole world of barefoot massages out there, and they hold on to all manner of things. That could be one bar, it could be a rope, single rope dangling from the ceiling, or a rope stretched across the room. They could even hold on to, those parallel bars that gymnasts use, where they're kind of like pushing up like this on them, you know. People use that, but the thing about those kind of bars, the reason why we don't go that route is because it's compressing your wrist and your shoulder joint just as much as if you were using your hands to massage. And we're trying to get away from that. And if you have the bars over your head, it's going to help you stand up, open up your shoulders, decompress your wrist joint, because now there's a little bit of traction happening to all those carpals. It's going to help you reverse the kyphosis in your back because you're not bent over the table anymore. Open up your shoulders, change the medial rotation to be more open. You have a chance to stretch and get taller because you're not looking down anymore. So the overhead bars are really genius, and they're totally crucial to everything that we do.
Okay, and then, do you guys talk about meridians much with your style at all? Do you get into that?
No, we don't teach the theory. Here's the thing. There's a lot of barefoot massage out there. And in a nutshell, we're a Western adaptation of many styles of Eastern bodywork. We came from shiatsu and anma, Shiburi Theriamal, Thai massage, and a lot more. But also, we're heavily influenced by Ada Rolf and just regular Swedish massage and a lot of other things. So we don't teach the theory of any of our East Side ancestors, just the application of the work with the West Side focus. What makes Ashi pretty appealing to the American public is that we're skin-to-skin contact, like every massage most of the American public is used to. And you get to lay on a massage table just like you're used to, so it's no weird thing when you walk into a room and you have to lay on this hard mat or something. It really does feel like a deep tissue Swedish loamy, flowy, gooey, yummy massage. That's really so it's not like pummeling in any way or aggressive feeling. And from first glance, the American public can just see it and be okay with it and not be intimidated by an unusual setting. Sometimes they don't even notice the bars in our ceiling. So it's really well thought out in that it's geared towards America, kind of like McDonald's, but we have more to us than just fluff and buff.
Yeah, because the problem is, I mean, if people want to know more about the Asian modalities like the meridians and stuff like that, that's years of training anyways, kind of thing. Yeah. So that's I mean, even with massage schools, there's no real time to really go over that stuff. They have to have a specific shiatsu school or something to.
It takes years.
Yeah.
So, and it's one of those things. Some of them are handed down in day-to-day culture. So there's no way we could teach you that in 3 days.
Yep. Or you can take Hooked on Meridians or something, you know, instead of Hooked on Phonics. Or
and you can totally apply whatever theory of like shiatsu or anything, and apply it to what we're doing, and you'll see the connection and why it's there.
Yep. Because even some Thai massage therapists, some of them are really big into the Sen lines, and other ones don't go over them much and stuff. But sometimes when you go over them a lot in depth, you're taken away from the techniques too. That's a problem. So. Yeah.
Yeah. You can go both ways.
Yep. Exactly. And do you guys? I mean, can you feel with your feet much, would you say? Do you think you can feel better or worse? Or
the same. I can feel everything with my feet just like I can with my hands. There's actually more touch receptors in your feet than your hands. And if you just relax your foot and quiet your mind, you can feel it. It takes a little practice, but I mean, you can always double check your work with your hands if you're not quite sure, but you can do it.
And does it help? For my feet, for my toes are actually hypermobile, so I can leave some huge bruises and stuff with my toes.
You know, I don't think we don't really use our toes too much because you could easily scrape someone with your toenails even if they're short. So everything we do there is some toe work, but not quite. It's more like the ball of your foot that we focus on because it's really easy to injure your toes if you're not careful. So we use the ball and the heel and the arch and the lateral edge a lot, but we won't like dive in there and go like that. Yeah. You need your fingers for that stuff.
Yeah. And do you think? I mean, does it feel any different than hands? Do people even think that you're using your hands sometimes?
Well, a lot of times they just say it feels like a big fat hand. And at the time, I'll blend from using my hands to my feet, and they won't even know the difference. They can't tell when I stopped using my hands and started using my feet. So it's all in the grace that you apply them with, and you get more and more dexterous as you start using them. So you can pull it off pretty well with a little bit of practice.
Yeah. and I've seen this marketed as the deepest, most luxurious massage on the planet. Is it?
I think it is. And usually, so once you try it, you might not go back to regular deep tissue either. What's cool about it is it's luxurious, but it's not just a luxurious frou-frou spa massage. It kind of plays a trick on your body because since our deep, broad pressure, it's not bony or pokey or painful. It's grounding and entrancing, and it definitely introduces the gate theory right from the get-go. So your brain focuses on that broad pressure faster than it would on a tiny little specific sensation of pain. So your parasympathetic nervous system is going to get access quicker, and you can zone out like that. And I've noticed that 20 minutes of Ashi does what it takes to an hour of traditional massage to do, whether it be the pressure or the zone out factor or just getting access to the deeper layers of the tissue. You can get there real quick with Ashi just because you have a bigger tool, and it's easier to apply the pressure. And Ashi, it can be light or deep. It's harder to do when you try to pull off a lighter Ashi because you got to hold up your leg. But if you do it deep, you can be real specific and general, or you can do kind of injury treatment work for sure. That's what I do a lot of, or just use it for relaxation. People use it in all different situations all around the world. They're at doctor's offices. They're working on Olympic athletes. They're in spas. They're on Vegas. They're in private practices and gyms. You name it. Ashi's everywhere.
The Ashi plague. So you mentioned a little bit about the benefits. Are there other benefits that really stick out?
Well, for the client, there's a real basic one that you kind of just overlook when you're massaging, but circulation is a big one. The consistent broad pressure that we give addresses layers of the tissue that might have been suffocated and ignored for a while, because you know how the body just doesn't want to deal with something sometimes, and it just shuts it down, reroutes everything around it. So our long head-to-toe strokes really help melt the adhered tissue. Can't talk today. And it awakens all those fluid pathways to just help nurse the cells more effectively because everything's taking a deeper route. The benefit we're most known for, though, is our compression traction that we do to the spinal column. Our push-pull pumping effect, which you'll hear us talk about a lot. It's something that is taught in our advanced Ashiatsu class. It's also known as DP2. Anyway, we actually traction each individual vertebrae along the disc in between. It gives it room to stretch and breathe, and then it gets suctioned back into the more central location between the discs. So fluids around the joint are pumped right back in to the disc and the nucleus pulposus, so it totally rehydrates everything and gives it more mobility. I don't know why I can't talk today. I'm nervous.
It's a little late at night, too, so... And the reason why I have to show this late is because I have young kids, so they're in bed right now, so... This makes sense for me too.
Wait,
Yeah, yeah. And what kind of client is this ideal for, would you say?
anybody with chronic pain, anyone who's looking for a deep tissue massage. It's really effective for relieving pain associated with things like scoliosis or just lumbar pain, sciatica, thoracic outlet syndrome. I've even found it works for fibromyalgia. There's a lot of people that it's not ideal for. We don't ever recommend that you just do this on every single person who walks through your door. And in our classes, we really go into the contraindications of everything so that you know when it's safe to use it. So there's a lot not to do. People on blood thinners, people within 9 months of surgery, anyone with a loss of nerve sensation or heart conditions. I mean, there's the big obvious ones, and then there's more little ones that you wouldn't even think of. So you got to come to class to figure out how not to use it.
Great marketing ploy. And can you guys perform even like myofascial release or different modalities like that then?
Yeah, actually, Ruthie's a Rolfer, and when she was developing Ashiatsu, there's a big influence from Anna Rolf's work and myofascial release in there, and I feel like I'm surfing the fascia the whole time I'm doing an Ashi session. So it's very therapeutic. It's very releasing. You can feel everything just melt underneath your foot, and totally change everything underneath that's happening, just like you can with your hands. It's just another way to do the same thing you're already doing. Easier.
Okay. And what are clients saying about Ashiatsu then?
You almost said it. I'm going to train you to say
yeah. Just like I'm sneezing. Ashiatsu.
Or I'm going to start saying massage nerd.
Yeah. Or some people message nerd.
Ouch.
Yeah.
Anyway, clients love it. Usually every Ashiatsu therapist across the country probably has a drool bucket full by the end of their massages. I've heard reviews from people saying, it's the best massage they've ever had. I've also heard like those biblical proportion type reviews where the person was wheelchaired in and the therapist had to help them on a table and roll them over, but by the time they were done getting Ashi, they could walk out and run away. So in a good way, run away. So that can happen in any massage. It's just Ashiatsu. It brings out a lot of good. Here, I have a recent, review. You want me to read it?
Yep.
Okay, here it goes. It's kind of poetic. All right. I felt toes poking, heels digging, and soles sweeping and gliding as every muscle was kneaded and every joint gently pried in this thoughtfully choreographed dance across my body. I felt myself lost in a blissful state, losing my sense of time and hoping it wasn't over. It's obvious that the therapist loves her work, and I'm certain that's what I was feeling.
Aww. That is sweet. Yep. And are there a lot of benefits for the massage therapist then too?
Yeah, it's actually a really exciting modality to add to your repertoire. It's fun to do. You get to dance and challenge yourself, because when you're learning to massage with your feet, it's like learning to massage all over again. So you might think you're the best massage therapist in the world with your hands, but then you try doing it with your feet and everything is upside down. So it's cool to learn to use a different tool and challenge yourself in that way. It's going to add longevity to your career, and it really helps relieve your client's pain. Doing Ashiatsu is going to help greatly in calorie burning and muscular toning. So sometimes you can skip out on your gym for a little bit. Usually every area that most people would like a little less jiggle in their body gets pretty well toned up from Ashi. Kind of like, how you go dancing and you have fun, and then you start noticing your abs are hurting and your adductors are hurting, and then maybe your glutes and then your triceps. That's totally what happens in Ashi. And so it's a fun workout, and you start to feel the burn, and then you look in the mirror and you've totally lost a lot of weight. It's pretty crazy. But aside from the physical muscular benefits, it's going to help you get more quality massages daily. If you're a therapist who's getting hurt or burnt out after about 4 massages in a day, or maybe you can pull off those massages, but then you're dead tired and you can't have a life after, if you just replace some of that harder work with Ashiatsu, you'll have the energy and the mental clarity to keep on going, whether you want to add more massages to your books or you just want to go out and play with your dog and not be hurting the whole time. I mean, we preach that we shouldn't be in pain from what we do at work, so why are we letting it happen? You know, I just think Ashiatsu can really bring your body out of pain, and a lot of people, I'd love you to know about it. So here we are.
Yep. And can anybody learn Ashiatsu?
Oh, yeah, there you go. Yes and no. Well, for safety reasons, we reinstated a weight limit. We took it away for a while, but we put it back in. We found that if the person wanting to join class is fit, weight's not an issue. Great Ashi therapists come in all shapes and sizes and come from all walks of life, all levels of experience. We're not here to discriminate. The main thing is all about safety and the balance that the therapist has. I mean, if you know some Pilates and core strengthening exercises and you practice them before class, you're usually good to go. And we always have some suggestions for you to help. I mean, it goes for everyone taking the course because anybody can fall during an Ashi session if they're not careful. But if someone's over the weight limit, it's a bigger risk of injury for everybody, and we wouldn't want it to happen ever. I mean, and it's not many students of any size have ever fallen in our classes across the nation ever. I mean, it's really rare. It's normally more of a case of nerves rather than weight when it does happen because they're so nervous. But
is there a certain weight where it'd be a little bit harder then?
Well, if you're over 180, we just ask that you talk to us about it so that we can help make sure that you've got the upper arm strength to hold yourself if the worst should happen. And there's a couple core and adductor exercises. We want to make sure you can balance for a little bit, maybe do some flexibility tests to make sure you can lift your head up over the client's head and sit on the bar stool without whacking them. It's just little things that you probably wouldn't even think are in class. We just want to make sure you can do them without hurting anybody. That's all. I mean, when I took the class from Jeanette, she gave me a laundry list of workouts to do. And I was a dancer, so I kind of looked at it like, whatever. Seriously? And anyway, I did some of them. I didn't do all of them. Sorry, Jeanette. But anyway, when I got to class, I struggled too. So there are some certain things that you just need to talk to your instructor about before you sign up for the class, just to make sure you can be ready and have a fun time in class and not worry about the little things like that.
Yep. And then somebody on the chat asked, those Ashi workshops are so much better and more detailed. You really get a big bang for your buck. You should ask Jeni why.
Right. I think we touched on it just a little bit when you skipped forward in the interview.
Yep.
It's that 8-person ratio. I mean, the 8 people to a class. Hold on. I have notes on this so that I don't mess it up. Here we go. Okay. We have really fun and intimate workshops, and we're consistent from coast to coast. So if you're taking a barefoot basics class from Christina in Hawaii, or Sarah up in Connecticut, or Pilar in Florida, we're all teaching the exact same work, almost down to the minute even. You'll get the same quality work from all us trained instructors. We've all been trained by Ruthie at length in detail. And really, I mean, we're a passion-driven modality. We're not profit-driven, so it's not about the money. It's about getting you comfortable and understanding the work before you leave. We want you to absorb the details and really have that full understanding of the modality before you go. You get to feel every single stroke from the instructor so you know what it should feel like. It's really great for kinesthetic learners. And people who are visual or auditory learners, you're going to get to see me do the stroke daily and explain it at length. So it happens, you get to absorb it in a lot of different various ways. It's a 3-day class for Barefoot Basics, and I know there's a lot of times you might go take a massage course and there's only like 1 or 2 moves you really are going to use afterwards because maybe you grasp them the most or whatever. Maybe that was the only thing that was useful to you, but we want you to be able to take more than that home. So we really try to instill a sense of confidence with your feet and just make sure you understand the importance and the application of every single stroke. So the amount of practice time and consistency you learn in Ashi class will only help you apply everything you learned over the weekend to the massages you do on Monday. And hey, another cool thing is You get to massage the instructor, and it's not just because I want to massage in class. It's more so that I can give you feedback, or the instructor, anyone, any of us, can give you specific feedback on your stroke to help you be that much more stellar of a therapist outside of class. We bring in guest clients, which are real people who aren't massage therapists, who don't speak in our language, who speak in layman's terms, sorry. And that way you can massage them. They're bigger bodies, so the type of bodies that are meant for this work. And lots of therapists think that's the bestest part of the whole class, when they finally on the last day get to put it all together and work on a big old body. And that's when they see how much easier Ashiatsu is.
And then somebody posted in the chat, since 1995, you guys have graduated close to 5,000 body workers and never had a liability claim or malpractice. So that's awesome.
Yeah, that's just that. It goes back to the instruction. We're really big on safety, and we're really big. All the instructors are seriously very trained by Ruthie. We go through a big internship program with her to make sure that we know inside and out how every single stroke works, how to construct the bars, how to have a safe classroom, how to teach everybody in all different manners of way. That way, everybody grasps it, and they don't hurt their client on the table, or worse off, clients outside of the classroom. Because anytime a client gets hurt by a massage therapist, it's not only possibly looking bad on the modality, but more on our career, on our whole field of massage. So that's saying a lot that we've never hurt anybody. That's great.
Yeah. and I had this question about that. Every now and then, maybe a therapist might develop like repetitive stress syndrome, and they might want to find a different modality. But let's say they have carpal tunnel syndrome. Is it hard for them too because they're holding on to something?
No, because we're not death gripping the bars. Okay. I mean, we're hard.
I like that term.
There's a few, like when you get to the advanced stuff, you do have to hold up your weight, but the basic classes, I mean, there's only brief moments where you're grasping the bars. And honestly, if it's a wrist issue, having everything up and open is going to help all the nervous pathways open up more and the circulation come, and it's going to traction your wrist by holding onto the bars and help stretch out all the tissue. So it's actually going to possibly help you get better. An example is in January this year, I broke my wrist, not from Ashi, but from roller skating. And I was in a cast for a long time, and I could still do Ashi. And so I don't need to hold on to those bars. I just have them with one hand. And honestly, if I didn't have Ashi, for 6 months out of this year, I would have been out of work.
Oh, yeah.
So, because I couldn't use my hand. Yeah. I only just got the extension back in it. So it's a career saver.
Yep. And what are some other things that makes your classes so special, would you say? I mean, besides the really small class sizes, more individual attention, is there any other things that really stick out for your classes? Do you like to have fun?
We love to have fun. We have really funny names for our strokes. I mean, there's Morticia's Rack, Warrior. Mary Claire's going to kill me for saying this, but there's one called Peeing in the Woods. You wouldn't know what we're talking about unless you saw it. It's hilarious. Some of these moves really describe exactly what's happening, and they help keep it in your head so you remember it later. Because if we just said, go in laterally, turn and head caudally, using the lateral part of your foot, and then turn and rotate. Blah, boring, no. So, use the wiper instead of all that roller skate. So it's fun. More corny, but still professional.
Yeah. And do people have to go in a certain order for the classes then? So let's say the beginner's class and then go more advanced. I mean, how many levels are there? How many different classes are there right now?
There's 4 classes. 2 of them are beginners. So there's the traditional way of moving through is Barefoot Basics. That's our beginner's course. It's 3 days, 25 CEUs, and you can find it anywhere really from any of our instructors. Then the next step is anterior side lying, which is a 1-day course, and it's 8 CEUs. And then once you got those 2 down and your certification down, you can take our advanced Ashiatsu course, also known as Deep Feet 2 Infusion. We kind of changed the name there. But it's another 3-day course, and that's when you learn how to use both of your feet and do all the body pressure and learn the real flowing version of all the work. Our new class, that Ashitai that we were talking about earlier, that's a beginner course. So you don't have to have any Ashiatsu experience prior or any Thai experience prior. Just be a massage therapist and come. It's a 2-day class. It's 16 credits. And it's actually a cool way to start. I've seen a lot of my therapists start with Ashitai and then go take Barefoot Basics, and they're stellar. But you can't take just Ashitai and skip up to advanced. You've got to backtrack and take Barefoot Basics, anterior sideline, and then advanced.
And you know, some states are not regulated with massage. Are you anybody allowed to take your classes, or do they have to have some kind of certification for massage in order to actually take them then?
I think that seems to be up to the discretion of the instructor. I'm kind of a stickler, so I want to make sure that they have a high level understanding of anatomy before they come into class. I know it's been taught to people who aren't licensed massage therapists, and sometimes, like you said, some states aren't even licensed, but they know their stuff, and that's fine. But we are a massage modality for our field specifically, so we try to keep it in that vein.
Yeah.
Yeah.
And then you said the classes are pretty much offered all over the United States then?
Mm-hmm.
Okay.
If you go to deepfeet.com, where's that thing? Right here, deepfeet.com. You can look up by just a nationwide listing of everything, or you can narrow it down by instructor or narrow it down by location. We've got 19 or so training facilities permanently located across the country. We even have one coming up in Italy in April, and hopefully I'll get back to Germany next year too, so you can always make a vacation of it and go away to learn. And some of our instructors even come to you. So if you hash it out with them, we could come teach at your clinic or spa or school. It's kind of cool.
And do you need, do those clinics or spas, do they need anything special at all?
It's a whole different world. I got an hour talking about that right now. That's something you gotta. There is a little quickie explainer on the website, dpeak.com. I think it says something about portable versus. I don't have the website up, but just look up something that says portable versus in-house training or something like that, or on-site training. And it kind of goes over it. If we're going to teach on the portables, it changes everything. So I'd talk to your instructor.
Okay.
Make it easier. But it is possible. It just takes a lot more organization, that's all.
Do you guys ever perform this technique with a mat on the floor kind of thing instead of a massage table, or does it always have to be a massage table?
It's always on a top table. If it's not on a table under our bars, it's not Ashiatsu.
Okay.
So because you got to have the face cradle, and Ruthie's Rolfer, she wants everything in alignment. She wants that atlas straight and right in line with the spine. So if your head's turned to the side, for one, our feet are going to come up and smack your face. And for two, it's just your whole spine is compromised and it's not safe, and it changes our work entirely. So that's one of the things that sets us apart from other styles of barefoot massage, for sure.
And the portable unit, is there a certain weight limit at all for people to hold on to with that, or?
Well, yes. You don't want to we don't do our double-footed moves on those, because you never use it to hold up your whole body weight, only because it's a different support structure. Usually we'll have 3 supports on one bar, so the middle is supported, but on our portables, it's only at the 2 ends. I don't know if you can tell. You probably can't tell from the picture, but the bars on the portables are only held at the head and foot end of the table, so there could be the potential for a big sway in the middle if someone were to just hang on it. So it's not quite a weight limit. Maybe over 180 would be you just want to work real careful and smoothly and smartly and step on the railings of your table, and never try to pull up your whole body weight. Even I don't do that. So.
Yeah. And do you ever offer any of this stuff online?
Oh, we do have Ashitai as an online course. That's our only one we have home, only because it has way less of a danger factor than our traditional Ashi. But there's some hoops to jump through to obtain your CE hours and your certification, so it's not exactly easy. And honestly, I have to say, all of us instructors were the test market for that. Ruth wanted us to learn that new online Ashitai course before coming to her to learn it from her. And so we did that, and then we went to her house and we learned it. And I got to say, It's an awesome course. It really is. It's great DVD, really detailed manual, and I really got the gist of it, and I felt comfortable with it. But then I went to learn it live. Whole other world. There was so much more to it that I was missing. So it just goes to show even a really, really good quality DVD doesn't even give you the half of it. So we would never do that with our Barefoot Basics, Anterior Side Laying, or Deep Feet 2 DVDs. It's not safe. You're not going to learn the same stuff. There's things you can't just quite grasp from a video. I mean, honestly, you really have the potential to not only harm the clients under your foot, it can degrade the whole reputation of massage therapy, like I was saying earlier. I mean, it's a human body under you, and they're not an opportunity to just show off. We really encourage our students to treat their clients with respect and not to cheat themselves and learn the work for real. So I think personally that if we want the massage profession to just be recognized and respected in the general public and in the medical community, that we need to stay ethical and pursue high levels of hands-on or feet-on training from the source, not just from like watered-down imitations or 60-minute DVDs. I really think that hands-on is really the only way to go. Keep it pure and go.
Yep. And then somebody in the chat says, we don't want to push death by effleurage.
Is that Ruthie?
Yeah.
No, it's not. I mean, usually people hear the word effleurage and they think it means light. And we can go deep with it, but we're not trying to pummel our clients in any way. It can be a light to deep pressure, and we're not so deep that they can't breathe. We have this whole scale, analog scale, that we use as a training tool in class that we teach our clients. It's kind of like, I wish I had my manual here with me. I think I know it by heart. Here we go. So it's scale 1 to 10. 1 is like no pressure. It's like as if a butterfly landed on you. 2 is kind of like it's getting better. A 3 to a 5 is, yeah, that's getting yummy. A 6 to a 7 is it's a delicious. 6 to a 7 is exactly most people want the pressure. 8 is a hurt so good. 9 and 10 are just too much. So we usually try to have them hover in that 6, 7, and maybe an 8 range for all of our standing strokes. We have a whole seated warm-up routine that we do where we hover in the 3 to 5 range, that really yummy, juicy warm-up level of pressure. So we always warm and hydrate the tissue before we stand up and deliver the deeper strokes so that they're not injured or bruised or anything. It doesn't feel invasive. We gradually work light to deep, just like you would in a normal massage.
And with the certification, too, can you get certification for each level then, or do you have to go through all the levels? And
no, there's certification in Ashiatsu and then basic. So the two bottom level basic classes, those are where you get certified. It's getting certified isn't necessary unless you want to progress up to the advanced courses. But it's one of those things where it helps you. It's just an accountability factor. It helps you build confidence, hone your skills, and be accountable for your work. And it shows that you care enough about massage to take the extra steps to just ensure your full understanding of the technique. So our process of being certified is that you just practice and you document your massages. You have your clients fill out an eval form and you fill out a test. In some cases, you'll have to send in a video of you doing the work, or you might have to massage an instructor. But it really shows your dedication to the work and making sure that you're providing a safe and effective massage, and you're not just winging it, saying you do Ashiatsu and making up your own stuff and hurting people. It's there to make sure that you have pride in your work.
Yes, definitely. And do you guys actually teach people how to install bars?
Yeah, that's a big part of our classes. There's one very specific mathematical equation for it, which I could tell you if you came to class, but from that little diagram, 100 different designs are built because it's specific to the person's body and specific to the room and the table, and if they're built correctly, it's going to really help the person's body mechanics. So all they have to do is stand there, and it won't hurt their shoulders, it won't hurt their knees. They're not reaching for dear life to hold on, and they're not hitting their head on the ceiling. There's a whole lot to it, and all of our instructors really pride ourselves on taking our sweet time explaining how to build those things. And we're even there for you after class. If lots of my students think they got it in class, and then a week later when they're there building their bars, they're like, Jenny, what do I do? Oh no, and I walk them through it and over the phone. So, we're there for you after class. We do. It's not like we ditch you and run.
And I mean, some of these places that have massage businesses, sometimes they got the hollow ceilings. Is it really hard to have anything?
Mm-hmm. Sometimes you can actually. Oh, I can't say too much here, but
no, you don't know. I mean, is it possible? That's all you have to say.
It is possible. Anything's possible. I could tell you, but then I'd have to kill you.
No. Just don't send a virus to my Mac, okay?
Macs can't get viruses, I thought.
Yeah, once in a great while. And how do you actually convince clients to try this? I mean, especially, let's say they might have just a little bit of issue, maybe with feet or something.
You could not tell them. No, I'm joking. Joking. All right. So sometimes it's tricky because of those situations. Sometimes it's tricky because of they're just afraid of the potential pressure you could be delivering. You know, sometimes people find out you're using your feet to massage them, and they think you're going to squish them to death. So you really have to educate your client on the work that you're doing. Really work with feedback with your client as you're doing it. You know, maybe just give them 1 or 2 strokes, see how they like it, and maybe that's all you do. Maybe that's all you do. But maybe they love it. You never know. So you really have to tell them the benefits of it. Don't just tell them that it's easier on you. You would tell them the therapeutic benefits that they're going to receive from it. Maybe they're a deep tissue level and you can't pull off a deep enough massage for them, or you're too pokey, and you say, well, maybe this is more suited for you. It's honestly a whole lot of client education, and we help you with that step by step. We have a big marketing part of our workshop where we're going to talk about things like that. We're going to talk about how to market it to the public, your community, how to convince your spa director or clinic director to offer it at your spa. I mean, we have a lot of backup support from years and years of experience from our own graduates that we impart onto you to help you take this home and make it work. So.
And do people typically charge a little bit more for?
They can. Yeah, because it's a specialty massage in a way. I mean, you're spending a lot of money to come to this thing and learn how to massage all over again. So you have every right to charge more if that's your way of going about it. Some people, what they'll do is instead of turning it into a specialty massage, they'll put it in line with their deep tissue massage price. That way, anyone who is a deep tissue already can just slip right over into Ashi without any extra monetary commitment. Lost my train of thought there, but sometimes it can just replace your deep tissue, and even though you're not charging more, you might be able to do more in a day. So maybe now you can add 1 or 2 or 3 or 4 more massages on the day and not be hurt at the end, but you're doing more beneficial work to your clients.
And do you guys have to take extra special care of your feet then?
Yeah. You get to pedicures, you get to wipe them off. Sometimes you do them at home. You got to be picky now about where you get your pedicure because not everywhere is totally perfect and sanitary. And like our biggest fear is getting some kind of foot thing fetish, or not fetish. I'm sorry, foot fungus. Yeah. or what's bad is when they cut your nails too short and it just hurts. That sucks. Or they use that razor to get off your calluses. Ugh. So you gotta baby your feet, soak them in lotion every night, do a bubble bath with your glass of wine, and just keep them soft and pretty. I mean, your feet are an extension and an image of what you're doing. You don't want to have weird looking, nasty feet. It's a total insult to your client, and it's not sanitary. And, oh, by the way, speaking of sanitary, before every massage, as we're getting from the floor up onto the table, we clean and sanitize our feet each time. And if we get down off the table and come back to it, we do the same thing again. So we're just as cleanly with our feet as we are our hands, if not more so. Because we don't pick our nose with our feet.
Some people probably could. And do you have to be flexible in a way for Ashiatsu then?
There's certain flexibility that we look for. If I had more room in here, I'd show you. Imagine the massage table, and the person's laying face down in the face cradle, and you have a bar stool, even with the face cradle, sitting right there. You got to somehow get up onto that bar stool without interrupting your client's peacefulness. So whether it's lunging up there to stand up or swinging your leg up over them, and sitting on the stool and then kind of weaseling your way up, there's a couple different tricks you got to do to get up on the bar stool on the table. And it all has to do with hip flexors and adductors and hamstrings, usually. But then it takes a lot of core strength to pull it off, too.
And what if somebody has, like, flat feet? Is it harder on them?
I don't think so. You have more foot to massage with. We really teach you to hug the tissue with your whole foot. So your arch is going to be massaging anyway, whether you've got high arches or not. It definitely helps strengthen your feet. So if you're experiencing falling arches, it might help support that a little bit better. But I don't think fallen arches or flat feet or anything really to be worried about.
And what other kind of things do you do to with your feet to keep them up? Let's say somebody just thinks they have nasty feet, and is there anything that they can really do to make them better at all?
I would just start by, at first, getting some really yummy, like shea butter and slathering it on those puppies, and then putting some fuzzy socks on and sleeping in it for a week, and that'll help soften it. And then you can go get like a Mr. Pumice and just start sloughing it off in the shower. Someone on our Facebook page the other day had a great idea, and what they do is they clog up the tub while they're taking a shower and just kind of let that turn into like a foot soak as they're showering. So it's you're multitasking. But I don't really recommend going and getting them razored off. That's really abrupt, and that can actually just cause some more scar tissue and make them rougher and kind of glassy. It's one of those things, if you've got really rough feet, you've got to start working on them at first, because the clients are really going to feel every single little thing with your foot, and you really don't want them to be in any way contagious and or rough even, or if you got cracks in them. I mean, just work on your feet. It takes some time, and it's actually once you got them soft-ish, they'll only get softer the more you do ashi, because they're just going to be soaked in lotion from every day from now on anyway.
And are you able to feel with your heel at all?
Yeah, that's actually kind of equivalent to your thumb in a lot of ways.
Oh, it is? Okay.
Yeah, and our elbow. I mean, let me think. I'll feel a lot through my thumb. That's kind of one of my big antennas, or the ball of my foot, and sometimes my big toe. If I need a feeler and I'm looking with the antennas, those are the two things I think that speak the loudest.
And I think I think it was Cindy that posted a picture not too long ago about one of her stools, and she had a little cushion on the back of the stool.
Yeah. Was it Cindy? It was somebody, yeah. And then it's like a little ingenious idea. There's little quirks to Ashiatsu that you start to find out as you get into it. Sometimes the stool will wobble. I found that if I turn the stool kitty corner kind of diagonal where the legs are facing in a certain direction, it doesn't wobble quite as much. But they had that great idea to make up kind of a built-in bumper with some foam, and it keeps it from jamming back into the wall. But if you've got some stellar balance and you're really grounded, you might not even experience that at all. So it'll surprise you and happen every once in a while. Oh,
and Cindy said it was Mary Claire that did it.
That's what I was thinking of, Mary Claire.
Yeah, yep.
Genius.
And for your classes, how far do you guys usually travel? I mean, what do you said? There's 12 or 13 of you guys.
So
do you have a certain area of the United States where you guys usually go to for each of you?
We're kind of spread out everywhere. There's California, Vegas, Denver, Phoenix, San Antonio, Dallas, and soon Houston. I'm building it this month. Yay. Yeah. There's Chicago. Where's Cindy? Is it Cedar Rapids, Michigan, I think. Then there's Cincinnati, St. Petersburg. This is pretty good. I don't remember this all off the top of my head. Newport News, Virginia, somewhere in Delaware where Ron is. We have a guy instructor, Ron. He is hilarious. I just can't remember the name of his city. Oh, and then there's Sarah in Connecticut, can't remember the name, Nell out there. I can't remember the names of the cities off the top of my head, but there's 12 of us. We're spread out. And then, you know, we can come to you too. And Germany and Italy.
Yep. Where's your next place that you're going out of the States then? Have you got a...
out of the... Well, Ruthie's teaching in Italy in April, and I need to get on it, but I really want to go back to Germany next fall. So we can go back to Germany.
And you, I think Ruthie said that Delaware is where Ron is, and he's the only male instructor. I mean... Yeah. That seems like across the board too. I mean, males are just a minority in this field. So,
and a lot of people ask me, "Well, do guys ever get trained in this?" And yeah, why not? There's no reason why they shouldn't. And Ron is a bodybuilder, and he's a pretty big dude, and there's no reason why he shouldn't do ashi. It's saving his body, and he's fabulous at it. So, and I've had a lot of fantastic male therapists. So it has nothing to do with the fact that you're a girl, or you used to be a dancer, or you have petite little feet, or you're this small little framed cute thing. It has nothing to do with that. It has everything to do with just the quality of your feet and how you apply the work.
And then somebody said out of 5,000 grads, only 130 males so far.
Really? Yeah. Oh. I would think there was more than that.
Yeah.
But hey, what...
And is it?
I know I train handball.
Yeah. Is it a lot harder to work on really small, petite people?
It is, actually. While we're working on each other in class, if they're smaller frame therapists, it's harder to fit your foot in certain places. And also, they're not meant to take your body weight or even a portion of your body weight. It's really meant for people who are about 50 pounds over your weight. So if I'm 140, they got to be 190, especially for those double-footed moves. I mean, I still work on people my own size, and you just got to regulate the pressure and really trust your feet and understand and know what you're doing. But it's definitely invented by Ruthie for those big, huge linebackers. Like, it's for those people who you dread working on in normal massage, like the guy who walks through your door and he takes up the whole door frame, and you roll your eyes like, I'm never going to be able to break the surface of this guy's tissue. With ashi, it's a breeze. It's like your hardest client in the real massage world is your easiest client in Ashiatsu. It's really cool.
And
it's backwards.
If you had the choice, if you could actually do this, would you charge people a lot more if they're really small? Just because you have to work harder. So it's actually a benefit to be bigger then, right?
Well, I mean, I refer them away sometimes, or I talk them into a different form of massage that I offer. And Ashiatsu might not be appropriate for them, so I downgrade them, educate them a little bit, then they figure out why they don't need to have my weights on top of them.
Because I know in movies, a lot of times they'll see these petite Asian women giving these massages and stuff like that, but not your form of it, but more like barefoot shiatsu and stuff. So, I mean, that's the average public's perception, I would say, too.
Yeah. So if you're not that little petite person and you're my size or whatever, you're a normal framed person, it all has to do with your application of the work and holding up yourself on the bars if needed, or putting a lot more weight into the table rather than onto the client. So your standing foot is taking the weight. I mean, we teach you all this in class so that you know how to gauge the person as they walk in through the door, how you're going to approach the massage.
What about massaging the face? Do you massage the face with your feet?
No.
Okay.
Face, anything inside SCM or the belly. Abdominal massage is better done with the hands. And there's a lot of stuff that your hands can't beat the hands on a lot of things, like craniosacral. You know, there's no way we could ever pull that off with our feet. So, but you have feet on the face. That's not us. Sorry.
And is most of the treatment, is it mostly in the prone position or mostly in the supine position, or is it equal, or?
It's equal. I mean, we have a 3-day course teaching you the prone version, so we're working on the whole posterior aspect. But that's because that's where the majority of the work is. Once we have the 1-day class for anterior and sideline, but it's an overwhelming day of work because there's so much vocabulary that you learn in that. I mean, I can easily spend an hour doing just anterior and sideline, working on all the muscles that people actually need worked on. not just the crowd pleasers on the backside of the body. So it's super effective. I mean, a lot of courses I've taken that aren't Ashiatsu, I'm doing the same work with my feet, honestly. So it's very effective and very therapeutic.
Have you ever heard of any Ashiatsu therapists developing tarsal tunnel syndrome?
No, but I've only been teaching for close to 2 years, so it hasn't come across me. But I think that because we're trying to work with a relaxed foot and we have proper binding mechanics of aligning the knee over the foot, not past the knees, or we're not inverting or everting aggressively, that your ankle and your tarsal should be pretty well protected. We do go up like we're putting out a cigarette. It's called tarsal twist in a couple of moves, and we dorsiflex and use our heel, and it's called windshield wiper, where we're digging our heel in. But it's not the whole massage. We mostly use the broad surface of our whole flat foot to do the work, so the tarsal should be comfortable.
And
really stretching.
Yeah.
And getting their own body work too, you know.
What about a pregnant therapist? Is it easy for them to perform this compared to regular massage, would you say, or?
We should talk to Mary Claire about this one. One of our instructors had babies. She's our Ashi baby machine, and she was training me at one point, and she was pregnant and doing fine. So it actually gives you a little bit more pressure because you're a little bit more weight, but it didn't affect anything. You probably wouldn't be working up to the end, although she did. As for receiving Ashi while pregnant, that's a no-go. Better use your hands on that one. But if you're pregnant and giving Ashi, it's not a problem. And actually, what's funny, I don't know if this is worthwhile to talk about. It might scare some people away, but it would scare me away. A lot of people who learn Ashiatsu get pregnant. And it's something with the energy voodoo that our legs are doing. I haven't gotten pregnant, but a lot of people report that just after doing Ashi and receiving Ashi a lot, it just awakens the inner goddess, and babies, they come. But don't be scared by it, because I'm living proof that it doesn't happen. So if you're not looking for that kind of thing, it's okay.
and with your Thai version, do you move limbs around with your feet then, or do you actually?
Yeah, we'll lift them and then put it in our hand. It's pretty cool. So we can lift the limb and move it around with our leg and our knee and our foot. And if we need to actually lift them off the table, you know the one how they're like this, when you lift them like this in regular Thai massage, that one?
Yep.
That's the one I'm talking about. We do use our hands for that, but there's a whole lot of really, really cool stuff maneuvering their limbs around with our feet. And you're amazed by how much strength you have and how easy it is to do with your legs in comparison to bending over and lifting or crouching down and pushing up. Leverage really comes in handy with the bars in your legs. It's cool.
And Donna says she is the best at picking up limbs. So
Donna? Is that Donna Aloy?
Yep.
Ah! She is, or who is?
You are.
Oh. Hi, Donna.
Yeah.
I refuse to use my hands when my feet can do just as good a job, so I push myself.
Yeah, they call you the Ashi octopus.
Yeah. My feet are everywhere. That should be our new T-shirt.
Yeah.
My massage therapist is an octopus.
Yeah. And with Ashiatsu, do you guys ever perform two therapists on one client at all? Like a forehand massage or like a 4-foot massage?
Massage, yeah. Where is it? Laguna Niguel, I think. They were in a spa magazine featured about that. I think it's California. I'm not sure. But yeah, there's a couple of spas out there and a couple of massage therapists daydreaming about doing this, pulling it off. And it's probably just like normal forehanded massage. You got to come up with some kind of routine where maybe you're working each your own side of the body or top half, bottom half, whatever. But it's doable. I would recommend having a hydraulic table to pull that off, and a really wide one, because you would not want that table making noise underneath you. That would be scary, but it'd be fun to have another person up there with you.
And Ruthie asked, what has been your most rewarding experience teaching for her so far?
Oh, well, just being around Ruthie is reward enough.
Aw.
I love her, but I think just watching how many careers it's saving, and watching all these therapists get excited about massage again, and just seeing someone who was burnout and bitter come back and have a life again and love massage and take over their town and just be stellar. It's really cool to watch someone fall in love with Ashiatsu. I like that.
And
but yeah, Ruthie's the main part of it. She's amazing. I love everything that comes out of her mouth. You can't stop learning from her.
And do you see what's the future of Ashiatsu then, would you say? Is there anything in the works that's coming up? Or
I know we've got some new DVDs eventually we're working on. We're going to be at more conventions. I know for sure Portland AMTA next year. I'd love to just get us on the web a little bit more. I'm trying to beef up our website, our blog. We have a little social network that's private for graduates only. We're trying to get that more supportive and interactive for all the graduates that are out there, so they have something to look for if they need help. Hopefully more international courses. I mean, honestly, we see in 10 years it's kind of our vision that the majority of massage therapists out there would have some form of barefoot massage training in their toolbox, whether it's us or not. I mean, it just makes sense to use your feet and save your hands and go home without pain, and just using a bigger tool and using your natural body weight and gravity to do the work and save yourself all that stress and pain and everything. I mean, we really see in 10 years, more and more and more and more people are going to be using some form of barefoot body work, and we'd really love it to be Ashiatsu.
And Ruthie says she's truly blessed to have instructors like you on her team. Jeni, you are one amazing and honest advocate. So,
I think she picks out some special kind of crazy in all of us instructors, so that we can meet up with her. So we're all crazy, fun, really weird people, and I like it. It's a fun little family of instructors. It's a family of instructors and then a family of all of our students. We see them as more than family than just people who come to class, you know.
Do you guys ever have plan on having like a conference? Like all you guys get together and all Ashiatsu therapists get together? Or?
Last year I tried, because this is our 15-year anniversary, and I had it in my heart that we could like surprise Ruthie with this big retreat, and at least just for the instructors and her, but it didn't exactly pan out. But it would be cool, you know. But we're all so busy. I mean, it's one of those things that we all have to have an assistant, and we could pull it off one day maybe.
So if anybody wants to get a hold of you guys, you can just go to deepfeet.com, right? And then all the instructors are on there, right?
Yeah, you can find ways to contact us through there with our phones and emails. We're also on Facebook. It's just Facebook/Ashiatsu Oriental Bar Therapy. We're on Twitter. It's /AOBT. So we're in a couple different social networks. So if it's easier for you to find us that way, you can. But yeah, deepfeet.com is the source. That's how you find your classes, your instructors. You can even find graduates in your area. I mean, not everyone chooses to list, and only certified graduates have the option to list. But if you're interested in seeing what Ashiatsu feels like, if you go to deepfeet.com, you can go to where it says Find a Graduate and see if there's anybody in your neck of the woods, so you can feel our work, see if you like it.
Oh, that's nice. So people can check it out before they buy it, basically.
Yeah.
And let me see. Ruthie says, "Hey, what about the Grad Corner girl? How cool is that page?"
Okay, so that one that's the little private social network that I made with Ruthie for all of our graduates. Once you take a class, you can go in. It's got information. We kind of have a whole discussion board about contraindications that might have come up. So we discuss that and kind of walk people through suggestions or ideas or where to go look for more information. There's a weirdos to look out for option. There's marketing tips and ideas. It's also a really cool place just to network with other Ashi therapists and throw some ideas around. Maybe throw together a little event with your local Ashi therapists. I always try for any Texas event to get all my grads together, and I use the grad corner to do it. So whenever I'm out showing off Ashi at a convention or whatever, I call up all my Ashi grads through there and see if they'll round up and hang out with me and play on the bars. So it's just a baby in its stages now. I have bigger, better plans for it as soon as I can figure out how to do the coding for it on the site.
Yeah. Are you guys planning to be at any other conferences or conventions next year?
Like I said, we want to do the Portland AMTA. Ruthie wants to go to the Canadian Massage Conference. I really, really want to do the World Massage Conference online, and we're always at the World Massage Festival. That one is a blast. I love that conference. So we're always there. And then all of our state, wherever there's an instructor in that state, usually we show up at our AMTA convention for the state. So we'll be at those. Yeah. So, we're trying to get out there as possible. Sometimes it's tricky just because we've got those portable bars, and it's not like sometimes booth space is adequate or whatever, but we can make it work.
Yep. And then Ruthie also said Florida, FSMTA 2011 also.
Oh, yeah, I forgot about that. Yes. And Pilar, our new instructor, and she is amazing. She's so much fun. She's teaching out there. So she'll be heading up Florida from now on. So look for that. That's a big one. That big convention. I can't believe I forgot that. Sorry. I got Texas on the brain.
Yeah. And she said ABMP will get the first editorial spread on Ashiatsu Thai in 2011.
Oh, I didn't know that.
Now you know.
I'll talk to her later about that. That's cool. Yay!
Okay. And is there anything else we have left out, you think?
Let me look. Is there any, while I'm looking, is there any questions from people out there? Do you think?
Nope. I've been kept asking them the whole time. And
okay.
Yep.
I think there was one thing that I wanted to say, but I'm blanking out on it. But anyway, if anybody has any questions at any point, they can always contact any of the instructors. All the instructors know more than I do, honestly. I've only been doing this for 2 years. A lot of these other instructors have been doing it longer than me. I'm just the one who talks the most, I guess. I don't know.
So you got nominated for tonight, right?
I'm the internet addict out of all of us, so I put my foot in my mouth for this one.
And then Ruthie said code of ethics to represent this footwork.
Yeah, we have let me grab it. We do have a code of ethics for every class that we sign. It's one of those things where it's basically saying that we're going to help support you in any way possible, but we won't support you if you go and try to be an instructor without going through the proper channels. There's an amazing experience of becoming an instructor with Ruthie, with all the internship and training that you go through with her, following her around the country, learning every single thing you can from her, staying up really late in the night, drinking some wine, and talking about everything that goes into Ashiatsu. She tells you 100 different ways to build your bars, 1,000 different ways to market it, the exact way to do every single stroke. And it's more, there's more to teaching this than just saying this foot goes here, that foot goes there, and that's warrior. There's no way that anyone could take our Barefoot Basics class and pull off a successful class in real life. If there's people out there who are, there's channels to take to become an instructor and know what you're doing and be backed by a company, and the insurance like ABMP, AMTA, that new massage magazine insurance company, and the NECBATIMBA, the national. So there's proper channels to take to have an ethical way of teaching the work and be supported by a group rather than just winging it.
And do you know if all the liability insurance, the major ones, liability insurance carriers cover Ashiatsu then?
Yeah, they do, especially if you're certified. Actually, today I just talked with somebody on the phone about from that new massage magazine insurance company.
Okay.
And that was my specific question to him. It's like, do you know about Ashiatsu? He's like, yep. I'm like, are we covered? Yep. Do we need to be certified? Nope. So they know who we are. They know what we do, and they're cool with it. We're covered by and endorsed by AMTA and ABMP. There's another one in Texas called the TAMT, and they're cool with us too. But honestly, the only way to be sure that you're going to be covered by your liability insurance company is to make sure that you're certified through Ashiatsu. So finish your training, finish your certification process, and have your butt covered. And then just work safely and have the right equipment, and you'll be fine.
Okay, perfect. And then also Ruthie says safety. So
Yeah, that's everything to Ashiatsu. I mean, we teach you to look under the hood of your table. I bet no one has ever really done that. If you flip your table upside down and look at what's under there, sometimes it's just one sheet of plywood. Sometimes there's extra spines in there, like beams. Those are the good tables. If you've got extra beams in there, that's what you're looking for.
Okay.
You don't want to do Ashiatsu on aluminum Coke can tables or something from Costco or Walmart or whatever. You want the good, sturdy, solid massage tables with at least 550 pounds, I'd say, working weight capacity. So that's something to look for. I mean, if you might have the table that you've had since the first day of massage school and it's done great for you, but you might need to beef it up a little bit and get a stronger table just so it's not creaking and cracking underneath you. You'd hate to see something crumble underneath your feet while you're working on a client. That'd be horrible.
Yeah.
It's happened in a class. I was desperate. I had to use this certain table, and it was 20 years old, and the hinge cracked, and it was horrible. So just don't do it. Don't sacrifice just to make it work. You need to go get a better table, unfortunately.
And then Donna says, my instructors really held my hand, parentheses foot, while I was in the process of installing my bars. I called many times to make sure that, and they were here for me all the way.
Mm-hmm.
Yeah.
That's what we do, and it doesn't bug us. Actually, we kind of like it. So we'll walk you through step by step, and I think even for her, she came back and we did a little private one-on-one training. So that's an option too. I mean, we have all kinds of opportunities to refresh you in the work. You can come back and retake the course. You can have a private class, and we are just now starting to offer refresher courses, which is kind of like a 2 or 3 hour zoomed in approach to relearning just the details of what you might have forgotten. In fact, I have a double decker coming in January where I got anterior in the morning, basics in the afternoon. So you can just relearn what you've learned, and I'll be your Yoda, and we'll make sure you're doing it right.
And then also Ruthie says, body mechanics is so important for the therapist. When peeps put up bars just from looking at a photo in a magazine, they hurt their body mechanics. So. Yeah,
there's more to it than what you see. There's a certain width, a certain height, a certain diameter of the bar, certain spacing of the eye bolts, certain distance from the wall. It's that mathematical equation that I can't tell you about.
Yeah.
But
and don't tell me.
And it's not that I don't want people to know, but honestly, if we told people and they just put up bars and people started working on them with their feet, so many people could get hurt out there, and it would come back to the massage profession, and we don't want that. There's no reason why massage has to hurt, and so we're trying to just keep you safe, and we're not trying to hoard it, but we just want to make sure everything's safe out there.
And then Ruthie says she's got to fly teach with Teresa in Arizona in the AM. So got to go to sleep. Sweet Ashi dreams, everyone.
Thanks. Hi, Ruthie.
Yeah.
I can't believe she sleeps.
Yeah. She just pretends. Okay, so if anybody wants to get a hold of Ruthie or any of the other instructors like Jenny or Cindy or Mary or anybody else, just go to deepfeet.com. And also, again, they have the Facebook page, also Twitter also. So you guys are out there.
We've got a blog too, but that's a big long address. You can find it through the Facebook page.
Okay. Okay. So thank you very much tonight, Jenny, and I appreciate it. And I honestly learned a lot, because the thing is, I just saw it at the World Massage Festival, and there's a lot of questions I wanted answered too. So I got most of them answered, but some of them I don't want answered. So.
So I would say, well, you learned a lot by switching it from a shiatsu to a shiatsu.
Yep.
That's a big step. And I would say just go get it. Go try it from one of our trained therapists. And if they're not listed in your area on the website, email me or Ruthie, and maybe we can track down someone close to you who isn't listed. We have our ways.
Yeah. at the next convention you guys are at, and I'm there, I'm gonna definitely get one. I got to make time for myself. So.
On the first day, because those lists fill up fast.
Yep, definitely. So. Okay, and thanks everybody for tuning in, and appreciate it. So again, get a hold of Jeni if you have any more questions or you want to have a workshop in your region then. Okay?
Uh-huh.
Okay. Thank you, Jeni.
Thanks, Ryan.
Okay, good night.